Ever open a med search chapter, see all the bolded terms and feel lost before reading the first line? I've been there. Hi friends, I'm Nurse Mia and welcome back to the GetZen RN study group. This part 1 of the chapter, Key Terms Made Simple. It's exactly why we start here, because those terms make the rest of the chapter finally make sense. Key terms are just a small part of the work, but they unlock the rest. If you learn term first, the rest becomes easier to absorb. Those words are the foundation. Without them, you'll read the whole chapter as a guesswork. Most chapters start with 10, 40 terms, and each one connects at least one clinical pathway: lab, symptoms, nursing intervention, diagnostics. These are just test words. They show up in NCLEX terms, in nursing reports, and real patient conversation. Imagine your patient says, "Nurse, the doctor said my atrial fibrillation is causing hypertension and it might be from polypharmacy. What does that mean?" You will need a language not just to understand it, but to explain it with confidence. Let's break it down term by term, Q by Q, calm and clear. Let's get started. Hi, we have now the chapter 18, Assessment of Immune Function Keywords. So to guide you through it, you can see it's 30. We have 30 keywords, so it's very long, but those keywords actually, they are not just the board one. It's actually it's the brain map, the concept for this chapter, because if you know this one, then look on my outline little concept map that with boxes, and then you already know the chapter, so what it's all about. So we start with the first one, the adaptive acquired immunity. So it's the immunity developed after exposure of antigen. So imagine the vaccination or recovery from an infection like measles. Antibodies, proteins produced by B cells that neutralize antigen. IgG, antibodies targeting influenza virus. So IgG is the IgG, INA. Remember, you need to know those. Antigen antibody response, the immune reaction triggered when antibodies bind to antigen. Let me make a light as we go. So what we know about this, it occurs in autoimmune disease like lupus. And the next, antigen presenting cells, the immune cells that produce and present antigen to T cells. So if you note my little pictures, dendritic cells presenting antigens to helper T cells. The B cells, you see, we have B cells. So it's the white blood cells that produce antibodies. And remember where it's produced. You need to remember where it's produced. Where it's produced. I said in outline. Activate B cells become plasma cells producing the IgE, E as an elephant. In my pop quiz, I was talking and reading two questions and they have kind of the same answer. Basophils. So basophils is the white blood cells involved in allergic reaction and inflammation. Releases histamines during anaphylaxis. Then we have the cell-mediated immune response. It's the immune response involving T cell, not antibodies, used to fight viruses like HIV. Moving down into the page. Next, we have the complement. It's a protein system that enhance immune response. So this complement activation leads to cell lysis of bacteria. So really you can look on the picture I have in outline, and in you'll see those ones. Cytokines signaling proteins that regulate immunity. So the interleukins trigger fever and inflammation. Next, the cytotoxicity cells, and the T cells that destroy infected or cancerous cell. So the kills virus infected cells in, for instance, in hepatitis. Then trick cells. It's APCs that initiate the T cell response, capture antigens in skin, and migrate to lymph nodes. Eosinophil, it's a white blood cell involved in fighting parasites and allergies. If you look on my brain concept map that I show in outline, you'll see every blood cells, how it's categorized with the red and the white blood cells there. But I think this you know already. It's just repetitive. Helper T cells that coordinate immune responses. T cells that coordinate immune responses. So, did I? Oh, here with the white blood cells, think about elevated in asthma or parasitic infection. And with the helper T cell, it's to stimulate the B cells to produce antibodies. Here with humoral immune response involving B cells and antibody production, so effective against bacteria and bloodstream. Immunoglobulin, another term for antibody. So here it's the ING, the ING G, ING A, ING M, ING E, ING D. Inflammation, localized response to injury or infection. Here we have redness and swelling after a cut. And down the page, inflammatory, no, we have the inflammation. We said the inflammatory response, immune response triggering inflammation involves in histamine and prostaglandins. And then the innate natural immunity, it's non-specific defense present at birth, skin mucous membranes, and phagocytes. The leukocytes is general term for the white blood cells. Includes the neutrophils, lymphocytes, and monocytes. The lymphocyte is the general term for the lymphocytes is the white blood cells, including B and T cells. So it's central to adaptive immunity. The macrophage, large phagocyte that digests the pathogens. So it removes the debris after inflammation. Major histocompatibility complex protein that helps this cell recognize antigens, key in organ transplant compatibility. The mast cell is the cells releasing histamine during allergic reaction. So it's a cause of symptoms in hay fever, for instance. The monocytes, large white blood cells that becomes a macrophage. So it's found in chronic inflammation. We're almost done. So happy. So the monocytes, we said. The natural killer cell is the lymphocytes that destroy virus-infected and cancer cells. Act without prior sensitization. Then the neutrophil, most abundant white blood cell, first responds to infection. So here is the elevated in bacterial infection. The phagocytosis is a process of engulfing and digesting the microbes. So it's used by neutrophils and macrophages. Plasma cell, it's a mature B cell that secretes antibody, produce large amounts of IgG as a giraffe, as a good. The suppressor T cell, it's a T cell that inhibits immune responses, prevent autoimmune reaction. And the last one, and my dog is looking at me to go to the park. It's a time to go. Let's see, the last one, T cell. T cell immediate cellular immune response. So this include helper and the cytotoxic subtypes. So which term always trips you up? Drop it down below. So now I'm telling you my last thoughts, and thanks for you being here until now. Thank you so much for being here with me today. I hope this video helped make things feel a little clearer and less overwhelming. If this supported your learning, please give it a like or share it with your fellow nursing student who might need this too. Everything we cover connects back to the real nursing, wherever it's recognizing a lab, planning safe care, or knowing what to teach a patient. Let me know in the comments below, what was the most helpful thing you learned today? What still feels unclear or confusing? If this was what you hoped, and make it easy for you. If you can also let me know if you like the notes for this chapter. Check the description. I usually add some free resources there just for you. Thank you again for your time and trust. I'm Nurse Mia, and from my heart to yours, until next time, stay zen, stay grounded. Namaste. Bye for now.